Do you experience dizziness in Singapore but feel like you're suffering alone? Research from the UK suggests that 10 to 20% of the population may experience some sort of chronic dizziness at any time. In Singapore, that means it's up to 1.2 million people who are experiencing dizziness. Comments on the research from Changi General Hospital, CGH, has suggested that up to 70% of the people who do come in to see them are not experiencing any abnormal results when they go for any of their tests, like MRI scans. Because the testing isn't able to find a confirmed diagnosis for these people, they suggest that they may have chronic subjective dizziness, or PPPD. PPPD stands for persistent postural perceptual dizziness. This is something which doctors believe will be triggered by a certain type of event, such as a small knock to the head or something else physical. However, the brain gets stuck in this heightened state where it cannot return back to normal when it wasn't feeling dizziness. Essentially, it's like repeating something, repeating a feeling, like repeating an emotion. However, the problem with this diagnosis is it doesn't really give much of a form of any kind of treatment or intervention, which is quite clear. So instead, for a lot of these patients, they're then suggested for something which is going to be more mental and emotional effects, like CBT. And CBT is something which is respected and should continue to be respected within the medical field. However, for a lot of patients, as we see here in our practice, who have vertigo, dizziness, or other types of giddiness issues, it's not always something that's just in their head. For many people with different types of dizziness, especially if they can't find something very organic on their scans, it may be true that there is something that's happened, like a physical insult, and then maybe they are stuck in some way. But I wouldn't think of it as being stuck in the brain, but it can be stuck more physically. One potential way this can happen is if there is a physical insult, like an accident, an injury, maybe a small car crash, maybe even just a prolonged posture or bad sleeping habits, then it can start to affect these joints that we see here at the top part of the neck. We call these your C1 and your C2. And running through the center of them, we have nerves. These are the ones in your upper spinal cord. Just above that are the ones that we have in your brainstem. And this combination of these two areas has a big effect on your balance and your perception of the world around you, partly through your auditory system, partly through the vestibular system, and then also through your proprioceptive system. These three systems combine all the information together so that you have an idea of where you are spatially within the world. However, if we have a problem at this top level, it can start to affect that vestibular system, the visual system, and the proprioceptive system, which all are sending information to the brain about where you are in space. And if you aren't getting the right kind of information, you're going to start to feel dizzy. Here at Vitality Chiropractic, we specialize in this area, looking at any areas like this which may be more misaligned, helping to correct them, removing the pressure off of the nerves in that area, which allows those three systems to work together properly so that you can feel more balanced in your daily life. If you've already been to see doctors, maybe you've tried a different number of scans, different types of medication, maybe you've had injections, maybe you've had lots of different interventions,